What's going on, everybody? Tell you, coming at you a little charged up today, to say the least. We'll get into it. All right, good evening, everyone. I'm Dr. Joaquin Acosta, your host for tonight's Know Your Pharmacist live stream and the dedicated CEO of PharmTruth. Tonight on the special February 8th edition, we're not just uncovering facts, we're diving deep into the heart of healthcare's most pressing issue. In our Pharmacist Frontline segment, we'll explore the heart-wrenching tale from a CVS pharmacy, a stark reminder of the intense pressures pharmacists face daily. It's a story that resonates with all of us, urging a reevaluation of how we support these unsung heroes in our community. Then, in Tech Talk, we'll shift gears to celebrate innovation with the Jefferson County Joint Vocational School's latest high-tech tool in health education. This exciting development exemplifies the fusion of technology and learning, shaping the future of healthcare professionals of tomorrow. Our Enlightenment Hour takes a serious turn as we scrutinize CVS's recent $250,000 fine and probation for understaffing issues in the state of Ohio. This segment is not just about penalties, it's a crucial look at how corporate decisions impact patient safety and pharmacy practice. In the Herbal Wellness Corner, we'll dissect a recent study linking cannabis to anxiety disorders, challenging the narratives and media representations. Here, we aim to bring clarity and evidence-based insights separating myths from facts. Our community spotlight shines on the White Sands Missile Range Arts and Crafts Center, highlighting the transformative power of art in healing and wellness. Their unique approach reminds us of the diverse pathways to health and well-being. Lastly, in our Men's Health Minute, we'll address the lack of accurate representation in men's health information, calling for a change in how we discuss and address men's health issues. Google, I'm talking to you today. As your host, not just here to share knowledge, but to connect with each of you. Tonight, we embark on a journey of discovery, empowerment, and change. We're not just talking about health, we're shaping the future of it. Together, let's explore, learn, and lead the way into a healthier, more informed world. Thank you for joining me tonight. Let's make this a live stream, a milestone in our continuous quest for knowledge and improvement. Remember, be part of this journey and your voice matters. Engage, question, and be a part of the change. Here's to a night of enlightenment and empowerment. Welcome to Know Your Pharmacist. Let's get started. So, guys, nightmare on CVS Street yet again. And you know what just kills us about this in the pharmacy world is that the pharmacy world has been screaming, for this exact reason. CVS pharmacist death becomes cautionary tale of crushing stress at work. USA Today breaking down the stories. As much as us going through this story right now is going to be, very, heart-wrenching, at least for us in the pharmacy community. This is just insane, right? And it doesn't, it's a big wake-up call. Pharmacy industry, there has been walkouts from CVS, from Walgreens, from Rite Aid since September of last year, a little bit of unionizing there. That's been happening because of the working conditions that, big box pharmacy has monopolized and been able to create, right? They're not only treating pharmacists as slaves, right? This is, it's affecting healthcare in so many different ways. We're going to look at it a couple different angles. Today in this segment here, we're talking, commemorating the life, of what happened. And from there, guys, we're going to look at CVS's fines in our Enlightenment Hour in the state of Ohio. Board of Pharmacy actually, taking a look at that. And, it is important that came to light today because this whole thing is it is heartbreaking, guys. We really look at the whole thing. We're going to read the story. And I have a funny feeling the pharmacy world is responding because this hits home for a lot of people. Retail pharmacists, as I've said and alluded to before, they're like NFL running back. got about a 3 to 5 year lifespan for work out. Those that last, put up with some BS for chasing, obviously living for their family, all those things in a job scarce environment. But the overall, costs of just the detriment from, our failed healthcare system here in the United States of America is part of the corporate greed that has led to trying to robotize pharmacy too much, right? And remove the people without addressing the fact that you're removing people to take care of people. So, looking at the story, guys, CVS pharmacist death becomes cautionary tale of crushing, right, stress at work. In the morning she died, Ashley Anderson researched her symptoms: nausea, jaw pain, chest pain, cold sweats. I think I'm having a heart attack. The 41 texted her longtime boyfriend from the CVS store in Seymour, Indiana, where she had just begun her shift as the sole pharmacist that day. It was September 21. Retail pharmacy was reeling from the pressures of the pandemic, and frontline workers like Anderson were dangerously burned out. For months, they'd been filling prescriptions, vaccinating patients without bathroom breaks or a bite to eat. Anderson's phone buzzed. I hope not, replied her boyfriend, Joe Bowman, who suggested the symptoms could just as easily be indigestion, stress, or something with the lungs. Anderson was a smoker, and her job induced plenty of stress, but she had just been to the doctor 2 weeks earlier and, according to her family, received a clean bill of health. Can you take a long lunch and decompress? Bowman asked. I can't, she said. The CVS in Seymour was a 24-hour store whose pharmacy counter never closed, not even for lunch. Patients came at all hours to pick up medications, ask questions, and get shots. It was a relentless grind made worse by the recent departure of 2 staff pharmacists and a pharmacy manager. In their absence, the remaining crew struggled to fill the hundreds of prescriptions coming in each day, and had fallen behind by more than 1,000. Tensions were especially high that week after Anderson learned her boss had assigned her the role of pharmacy manager despite her repeated refusals to take the promotion. I am livid, she messaged a coworker 4 days earlier when she discovered the change in the company's HR system. State law at the time required every pharmacy to designate a pharmacist in charge, someone to hold accountable for complying with regulations and discipline for violations. And this is, Ashley Anderson. So covering the story more, but Anderson didn't want the extra responsibilities. After 17 years with CVS, including previous stints as a manager, she was content with being a regular staff pharmacist. She'd clock in, clock out, and go home to Bowman and her beloved basset hounds without the job following her there. If anyone could handle the gig, though, it was Anderson. Whip smart, selfless, dependable, she had managed one of the busiest CVS pharmacies in Indiana just a few years out of college. A historic flood inundated her store in 2008. She kept working until the National Guard arrived in boots to rescue everyone. The following year, she won the company's highest honor, the coveted Paragon Award. Anderson was calm amid the chaos, but that morning when she texted Bowman, she was worried. She was having a heart attack. She needed medical attention, but if she left without another pharmacist to take her place, she would have to close the counter. Prescriptions would get even more backed up. Patients would be upset. And the store's performance, closely tracked by a series of corporate metrics, would suffer more than it already had. Anderson couldn't reach her boss, so she texted his assistant at 10:11 a.m. I know this sounds crazy, but I'm having symptoms of a heart attack. Can you get someone out here long enough for me to go to the ER and get checked out? 3 minutes later, the assistant called. He spoke briefly and then hung up. I talked to Jessica. Anderson texted Bowman, referring to the assistant. She told me to close and go, but I told her to find someone if she could. Bowman replied, are you coming home or going to the closest ER? Do I need to pick you up? Almost 35 minutes to the south in Henryville, Indiana, the closest emergency room was just down the street at Schneck Medical Center. Anderson could arrive there in 3 minutes. The assistant called again and the two spoke for 46 seconds. Then Anderson sent Bowman what would be her final text. Bob is coming back now. I will go to Schneck here. Hopefully it's nothing. I will come back to work. 15 minutes later, she collapsed on the pharmacy floor. Customer who happened to be a nurse raced behind the counter, started CPR while Tech called 911. First responders arrived within minutes. They ventilated her, gave her chest compressions, gave her the defibrillator. Nothing made a difference. They loaded her on an ambulance. Her pupils were fixed. She had no pulse. She was done. Autopsy later revealed there was atherosclerotic cardiovascular disease with 99% blockage of her left descending coronary artery, leading to what's called as a widowmaker heart attack. If she had gone in quickly when she realized she was having a heart attack, the artery would have been opened up and she would have most likely survived. But by waiting, she made the ultimate sacrifice to an industry that notoriously demands too much of its workers. Corporate culture's role blamed in Anderson's death. Over the past decade, corporations like CVS, Rite Aid, and Walgreens and Walmart have steadily slashed pharmacy staffing levels while saddling remaining employees with a burgeoning list of additional duties. Stores that once had 2 pharmacists and 6 techs filling an average of 500 scripts a day may have half the staff and an even higher prescription volume, plus an endless crush of vaccine appointments, rapid COVID tests, and patient consultation calls. Every task is timed and measured against corporate goals that reward speed and profit. Staff who do not fill prescriptions fast enough, answer the phones quickly enough, or drum up enough vaccination business can face discipline, reassignment, or termination. No chain exemplifies this ethos more than CVS. Dozens of current former pharmacists told USA Today. Many recalled how they have been pressured to work through sickness, physical injuries, and mental breakdowns. One pharmacist said her boss refused to give her the day off even though she was suffering a full-blown panic attack. Another said he was asked to stay behind the counter instead of taking his injured son to the emergency room. 2 pharmacists said they worked while actively miscarrying because their bosses couldn't find anyone else to cover their shifts. Coming from here, my grandmother had died, and we had been with her here in the week, and I could only get the morning off to cover her funeral and couldn't even get the rest of my shift off to, stay with my family after, right? And that was, that was the day I realized enough is fucking enough, right? And anyways, so you're just programmed that if you're sick or if you need to go home, you have to wait until someone comes. The Wendy Lear, former CVS pharmacist who worked while miscarrying. Although she had never met Anderson, Lear knew her name. They all did. Words of Anderson's death spread like wildfire among retail pharmacists. It became a cautionary tale of a corporate martyrdom. It spawned a hashtag She Waited in a social media campaign that urged pharmacists to listen to their bodies, stand up to their bosses, and take care of themselves. Not long after she died, a bright orange billboard went up on Interstate 65 in Indiana between Seymour and Henryville. It featured a photo of Anderson along with the hashtag simple message, "Your job can wait, your heart can't." Guys, February is American Heart Month. It's a big deal. Your pharmacist is supposed to be taking care of you. And they're the big corporations that most of the pharmacists are taking a paycheck from should be doing a little bit better job taking care of them. Right? And, where Ashley's family is talking here, we were trying to get exposure to this because we thought it would gain media attention and CVS would have to deal with this on some level, but unfortunately it didn't pan out. USA Today interviewed Anderson's father, his stepmother, her long-term boyfriend, and 10 former colleagues who worked with Anderson at various times during her career with CVS, and many of them described Anderson's dedication to a job that some believe ultimately killed her. Some of those colleagues still work for the company and spoke on the condition of anonymity to prevent their jobs. Damn straight they had to, right? The media organization also examined text messages and calls to and from Anderson's phone the morning she died, as well as a summary of her final moments detailed in a coroner's report obtained through a public records request. A reporter additionally spoke to dozens of retail pharmacists from CVS and other chains across the country about the conditions and demands of the job. Completely insane. Taken together, the interviews and records paint a portrait of an industry that conditions employees to work beyond their limits and put their own needs behind those of a job. So strong is the culture that those close to Anderson say that even when she got permission to close the pharmacy, she must have decided it was in her best interest to wait for backup before seeking help. She was, in our opinion, afraid to go to the emergency room and be told, no, it's not a heart attack at all, it's just anxiety, her father said. Larry Anderson, because then she would have to come back and face her bosses. It's impossible for me to comment on why Ashley made the decision she made. Michael D'Angelo, CVS Executive Director of Corporate Communications, IROL, called Anderson's death a tragedy that should have never happened. He pushed back, though, on the notion that CVS bears responsibility for her death, noting that she was told to leave and highlighting the company's culture of safety. Under no circumstances, he said, does CVS expect or want its employees to work when they are unwell and encourage them to seek medical treatment when necessary. As, oh my gosh, as you see a whole weight of evidence that so much was not true, right? It's literally, ugh. Possible for me to say on why Ashley made the decision she made. CVS Executive Director of Corporate Communications, Loser DeAngelis, said, I think by and large, pharmacists are highly dedicated healthcare professionals. But I would not be surprised if there are pharmacists who have the mindset of, I need to keep taking my patients versus I'm afraid of being punished by my employer. And maybe some do, but I don't think that's the case when it's a life or death situation in a hellhole. Although they acknowledge Anderson alone made the call to wait, Larry Anderson and his wife, Donna, still blame CVS for their death. The company cared about its employees. Anderson said it would properly staff locations so that no one pharmacist was stuck behind the counter reluctant to leave. There's an intimidation factor, Larry said. You don't feel like you can take your lunch. If you have a doctor's appointment, you're extremely reluctant to do it. You can't be away from work. That is all facts, 100%. Anybody who works for CVS or Walgreens will tell you that is true, especially if they are a pharmacist. You can't leave the pharmacy without a pharmacist being there. It goes down, and these corporations are built not to close. So, all of a sudden you get stuck in there, and you've got the golden handcuffs, to say the least. So, anyways, pharmacist was a rising star at CVS. Anderson grew up in and around Lafayette, Indiana, the eldest child and the only daughter of Larry and his wife, Nancy. As a girl, Anderson was adventurous, spirited, and naturally gifted. She excelled at everything, especially academics, and she had a soft spot for animals. Friends and family often called her the smartest person in any room. She didn't even have to try. She graduated high school as class valedictorian and attended the prestigious Purdue University located in her hometown. Anderson could have chosen any major, but she gravitated towards medicine and especially liked the idea of becoming a vet. The only problem, she hated the sight of blood. She was maybe a year or two in college when she decided to go into pharmacy, her father said. Pharmacy was an option that allowed her to be in the medical field without seeing a lot of blood. Anderson threw herself into her studies and learned everything she could and earned a doctorate of pharmacy in 2004 when she was 24, bursting with optimism and eager to prove her worth. No one was surprised when she quickly landed a job. CVS was lucky to get her, they thought. Anderson felt like she was the lucky one. She loved everything about her work as a retail pharmacist. Fast-paced, stimulating environment, the patient interactions. It was endlessly challenging, and Anderson relished her challenge. Her co-workers soon took note. I knew right from the start that she was going to be our next boss. Trish England, who worked as pharmacy tech in CVS Columbus, Indiana, where Anderson started her career, she was a rising star. She was the best pharmacist we had. They praised her for everything she did. CVS soon promoted Anderson to pharmacist in charge at one of its busiest locations in the state. Employees working in Columbus at the time recall handling between 3,000 to 6,000 prescriptions a week. Anderson thrived in her managerial role, and she was the master of pharmacy who could rattle off the answer to any question, efficiently clear a queue of backlogged scripts, and make patients feel like she really cared. Those kinds of people are what you call ballers. She ran a tight ship, her coworker said, and was an absolute stickler for quality control. CVS has a thing where technicians count prescriptions out and put them in a box that takes a picture and sends it to the pharmacist to verify they look good. She made us take the pills and bundle them in a group of 5 so that she could count them herself. We grunted like, why do you have to do this? But it was all for patient safety. Anderson's competency initially intimidated some of her coworkers, who said they thought she was scary or cold until they actually got to know her. Then they became fiercely loyal, describing her as a true friend whose warmth was surpassed only by her wit. Managers at the other store sent their pharmacist to Columbus to train with Anderson. Around the time she won the company's Paragon Award, she was invited into the Emerging Leaders Program, a stepping stone to upper management. Anderson set her sights on a district leader position, a role overseeing a dozen or so pharmacies, ensuring they hit their corporate targets. She seemed a shoe and fit for it. He was one of the best pharmacists in the area, recalled the CVS pharmacist who had to train under Anderson. He was the kind of pharmacist other pharmacists wanted to be. And then one day, Anderson sent her coworkers while leaving it all behind. In August 2013, she abruptly transferred the Columbus location to a lower volume CVS in Greensboro, Indiana, where she worked an overnight shift as a staff pharmacist. She dropped out of the Emerging Leaders program and stopped talking about career growth. It made no sense, her colleagues said. Some figured she just needed to change. Others assumed corporate forced her out for falling short of its rising target. It was always numbers, numbers, numbers. You have to hit your numbers. So the pharmacist who worked with Anderson and Columbus, the district manager would come and be like, how come you can't hit this number? How come you can't hit that number? At the same time, he said the store's prescription volume was exploding as the staff size was steadily dwindling. CVS decided not to replace the pharmacist who had recently left, and there were fewer technicians at any given time. Working conditions just got worse and worse. And they recalled the more we did, the more they expected us to do. And the numbers fell too far behind, they took her out. But one former colleague said Anderson's performance at the store wasn't the issue. It was an ethics hotline complaint that led to her removal. Right? Snitches get stitches. In the corporate world, a pharmacy technician took offense at the way Anderson handled the situation from the former colleague, a longtime CVS administrator who worked closely with Anderson over the course of her career. He was snappy, the colleague said of Anderson. You have to be snappy in the job. But one day she said something in the heat of the moment that she probably shouldn't have. Human Resources investigated the complaint, the colleague said, and determined Anderson should step down. The decision gutted Anderson, who felt like he did not get a fair hearing. They knocked her down a peg, Don Anderson said. After that, she stopped trying to be anything more than a staff pharmacist. Anderson spent the next several years commuting from Columbus to the CVS in Greensburg, and then one in Shelbyville, and then one in Nashville, Indiana, all within 30 miles of her house. When she and Bowman bought a newly constructed home in Henryville, 50 miles to the south, Anderson sought a shorter commute. She found it in Seymour. Anderson feared dying alone. The final CVS in Anderson's career sat at the intersection of a busy commercial strip, flanked by a large parking lot, which on that late summer morning was teeming with emergency vehicles. Andy Tharp would have seen them had she pulled in just minutes earlier, but the pharmacy tech was late for her shift. By the time she arrived, the lot was nearly empty except for two flying co-workers. One of them had approached Tharp as she got out of her Mustang to tell her what happened. Distraught, Tharp got back into her car and drove to the hospital. During 18 months working at Seymour CVS, Tharp had bonded with Anderson, the experienced pharmacist, had taken the new tech under her wing and given her the support she needed to excel in an environment rife with seemingly endless. In rare rules, the two shared details about their lives and learned they had a lot in common, as neither of them had any children. They confided in each other about fears of dying alone. Tharp was determined that morning not to let it happen. I wanted to know someone was there for her. She introduced herself to the emergency room receptionist and asked that someone inform Anderson of her presence. Since she was not family, staff could say nothing about her friend's condition and promised to let someone know if Tharp was there. And then she waited. I wanted her to know someone was there for her. I was there for her. Roman was at home when the phone rang. The call came from CVS store in Seymour, and when he answered, he heard the rattled voice of a pharmacy technician saying Anderson collapsed and paramedics were on the way. Bowman jumped in his vehicle and kept a lookout for the state troopers as he sped north on I-65 to Schneck Medical Center, not knowing what he would find when he got there. Tharp greeted him when he arrived. The two never met, but she recognized him from the photos Anderson shared. Bowman was grateful she was there. A doctor appeared and Bowman asked to follow him into a room. Bowman knew right then that Anderson was gone. He remembers feeling his feet carrying him into the room and his ears listening to the doctor explain that her heart had stopped. The explanation ended, and Bowman was led into another room. This one held Anderson's body. Bowman was given time to say goodbye. Time passed. 5 minutes later, an hour, an eternity, before Bowman reappeared in the waiting room. He looked at Tharp and shook his head. She knew then too. Tharp fell to her knees and buckled. Bowman caught her before she fell, and the two strangers cried together in the hospital over a woman they both loved. It was Bowman who broke the news to Anderson's parents. When they saw his number pop up on their phone, Larry Anderson said, "Your daughter for you." Bowman was calling to thank them for a large patio umbrella they had recently delivered that morning to his house. Then Larry Anderson had simply said, "What a shock." Family seek answers in this understanding. When the shock wore off, the family wanted answers as to how a seemingly healthy, active woman in the prime of her life could collapse and die at work. They knew CVS had expected Anderson to work through lunch breaks and bathroom breaks, that she felt pressure to come in even if she was sick. They knew her job stressed her, now they wanted to know if it killed her. Larry Anderson said he found the number for his daughter's boss, and his assistant called them, but neither wanted to talk. After 2 or 3 attempts, her boss finally did talk to him, but he was very careful of what he would say. But he had been instructed not to answer the questions, and I shouldn't be talking to you, but he was trying to be nice. The company's gesture of establishing a scholarship in his daughter's name at Purdue fell flat when CVS made a one-time donation of $10,000 in December instead of sustaining it annually as the family thought it would. The analysts denied that CVS avoided conversations with the family or that it ever committed to funding a scholarship beyond a one-time donation. We regret if there was any misunderstanding. Misunderstanding was taking root online. 2. Messages about Anderson's death started appearing on Facebook, Reddit, and Twitter. They claimed her boss had forbidden her from seeking immediate medical attention and then made her wait until backup pharmacists arrived. Among those who saw the post was Bled to Know, a former Walgreens pharmacist who amassed a large online following advocating for better retail pharmacy working conditions under the hashtag People is Not Working, a nod to companies' hollow offerings of free pizza to appease stressed employees. Anderson's death struck to know as a further evidence of an industry that mistreats employees, she told USA Today. We wanted to amplify the story and create a new hashtag around it, so she reached out to pharmacists in Indiana to verify the story. We confirmed that Anderson could not leave, according to messages to Know shared with USA Today. In October, To Know launched She Wait hashtag, and the story exploded among retail pharmacists online. By the time To Know heard the details might not be correct, she said, her sources had either stopped talking or she was no longer sure and the story had taken a life on its own. It's established in our profession there's a culture where you cannot put yourself first. Regardless, she said, the message behind the movement remains the same. Established in our profession, there's a culture you can't put yourself first. It may not be written in a handbook and they would never say it to your face, but the message through their actions is that the company comes first. In the 2 years since her death, Anderson's name has transcended social media. It now echoes through the college classroom of Haley Howard, an assistant professor of pharmacy practice at Manchester University in Fort Wayne, Indiana, where she teaches first-year students about professional self-advocacy. Howard uses Anderson's story to remind her students that they have a right to reasonable working conditions and to voice their concerns. More importantly, she tells them they can't fulfill their duty for their patients if they don't take care of themselves first. One of the examples that Howard includes in the company slideshow that shares advice with future pharmacists about how to advance their career at a time when many are leaving the profession and enrollment to pharmacy schools is in decline. Howard, who also works as an acute care pharmacist at Cameron Memorial University and Hospital in Angola, Indiana, never met Anderson, but she heard about her death from a fellow pharmacist who heard about it from somebody else. Felt like a wake-up call, she said, that more people need to be hearing. Pharmacists need to be in safe working environments. I want to share with my students along the way, this stuff happens in pharmacy and it should not be. Now, looking at that as a whole, guys, that story, I don't know how many times in a retail pharmacy situation where I feel like, shoot, that could have been me, right? And a lot of us other pharmacists, that listen to that or read the story or saw it online are thinking the same. And for those in my pharmacist friends in the community that have posted about this kind of thing, this specific story that just broke today, the USA Today story about 2 years ago, though, from the hard work of Bled to Know and everything there, guys. I mean, the whole thing is just gut-wrenching and another testament to the issues that the big box pharmacy is facing right now. And I'm going to jump into our Enlightenment Hour. We'll jump back to Tech Talk, but I want to jump into Enlightenment Hour first because this is something important in line with that, right? So the Ohio Board of Pharmacy took a stand, and I appreciate this stance. They fined CVS $250,000, placing it on indefinite probation and over understaffing at Canton store. The $10,000 one-time donation to CVS is nothing, right? $250,000 to CVS, probably not a whole lot, right? And we know that. You can go look at their profits that they at least report, over their corporate accounts and things. But what we're looking at, right, is this story. Because why is it important and what's happening right now that, in America is relevant to this? The state of Ohio Board of Pharmacy, thankfully, has taken it upon themselves to go after, these big box chains that are having crazy working conditions and, finding ways to punish and, intimidate their employees from being able to speak out about it and, creating these, not so fun golden handcuffs that have led to, the hashtag She Waited movement, right, that we just touched on. So, reading out through all this, guys, the Ohio Board of Pharmacy on Tuesday imposed stiff sanctions on a CVS pharmacy in Canton over short staffing in 2021 that the board concluded had endangered pharmacist safety. endangered patient safety. The penalties could be the first of many against the company because the pharmacy board is yet to adjudicate violations its inspectors have alleged against 14 other CVS stores. The board fined the company $250,000. As a condition of its minimum 3-year probation, the store must ensure that sufficient personnel are scheduled at all times in order to minimize fatigue, distractions, or other conditions which interfere with pharmacists' ability to practice with requisite judgment, skill, competence, and safety to the public. Staffing levels shall not be solely based on prescription volume in determining the need for staff. CVS store number 2063 shall consider any other requirements of the practice of pharmacy by pharmacy personnel during working hours. The pharmacy board also ordered CVS to come up with a system under which employees can request additional staff in writing to share those requests with the board. It also prohibited CVS from retaliating against pharmacy employees who report dangerous situations. Importantly, the ruling also requires the store to fill prescriptions within 3 days except those that are being automatically filled. Those have to be ready within 5 days. Violating the conditions would be ground for further penalties, up to and including the revocation of the pharmacy license. Board member Mindy Ferris said after listing the requirements. As for comments, the spokeswoman for CVS noted improvements the company has made to the Canton pharmacy since inspectors found problems there. We're aware of the Ohio Board of Pharmacy's decision regarding Fulton Drive Northwest Pharmacy in Canton. We continue to work with the board collaboratively, the spokeswoman Amy Thibault said in an email. The allegations stem from Board of Pharmacy inspections in 2021 during the height of the COVID-19 pandemic, and we made great strides to improve the conditions there in the years since, including putting a strong pharmacy team in place that continues to provide high-quality care to patients. We're committed to ensuring these are appropriate levels of staffing and resources at our pharmacies. I roll. Right? Sanctions came at the end of a hearing process that began in November. An inspector from the pharmacy board in Ohio went to the Canton store on September 13, 2021, found a staff that was so swamped they didn't notice the inspector for 20 minutes. It was taking 2 weeks to fill prescriptions sometimes. When the inspector made a follow-up call on October 29, 2021, the person had to wait on hold for 20 minutes. Then that person was told the pharmacy was over a month behind on filling prescriptions, the inspector report said. To deal with massive staff turnover and other problems, the store closed its counter and told customers they had to use the drive-through line to get their medicine. But even then, many weren't able to get through the line before the store was forced to close at 9. Haley Stanek, a former technician of the pharmacy, testified in November, hearing about being confronted in the parking lot by frustrated patients. I was cornered at my car by about 3 or 4 patients, all very angry, asking me what's going on with their medication, said Stanek, who explained that she understood their anger, but also that she felt threatened. One gentleman was trying to get his antibiotics for his son, who was very, very upset. In the pharmacy, inspectors also found phones that weren't working properly, malfunctioning coolers, and a lack of control over dangerous drugs. During the hearings over findings at the Canton store, lawyers for CVS blamed the coronavirus pandemic for the problems found there. It increased the workload by requiring staff to administer vaccines and other care while making employees reluctant to come to work for fear of catching the disease. However, the board, which is almost completely made up of pharmacists, didn't want to buy the argument. We hope that this decision will send a strong message to Ohio pharmacies that they have an obligation to serve their patients by ensuring appropriate staffing levels, Stephen W. Shinerholt, the pharmacy's board executive director, said in a statement. The board will continue to inspect and hold those accountable for working conditions that endanger patients and pharmacy staff. The CVS contended that the pandemic was to blame for the problems in Canton. Board inspectors found serious problems at other CVS stores in Ohio well before the worst had hit, and as recently as last September. At store number 10246 in Toledo, for example, they made 8 visits between March 2020 and June 2022. They found a pharmacy that was consistently dirty and disorganized, had expired or adulterated labels on its shelf, saw lengthy delays in filling scripts, created labels that didn't have proper instructions, and at least one instance of giving a patient the wrong drug. When interviewed, employees told inspectors supervisors/district managers do not respond to staff calls for help, the report said. The board will begin its hearings on those violations in March. CVS is a vertically integrated company that owns doctors' offices, sells insurance, and is the largest pharmacy retailer. Also is the largest pharmacy benefit manager in that capacity, and it decides how much to pay retail competitors and its own stores for the drugs they dispense. CVS says it maintains firewalls between its different business units, but some competitors suspected it of driving down reimbursements in the years before the pandemic and then buying up smaller pharmacies, then folded prescriptions from them into existing CVS operations. That's for damn sure they did. The company is now in process of closing 900 of its own stores, and testimony in Ohio hearings over Canada's store indicated the company added little staff to deal with the additional work. David Burke, a former state senator who is now the executive director of the Ohio Pharmacists Association, said Tuesday's sanction by the pharmacy board should serve as a warning against CVS house in order. Based on the facts and in the name of safety, the Board of Pharmacy delivered its first punitive action in nearly a dozen cases against CVS. Burke said in a text message, the message is clear. Putting patients at risk while demeaning the practice of pharmacy is not a well-tolerated business model in Ohio. So, right, the state boards of pharmacy guys are getting involved, in the absence of literally the better governance of pharmacies, and they're not liking what they're saying, right? Which state board of pharmacy is actually going to take a stand next? You know what I mean? Because all of the true public health outcomes are very, very tied to this. This is insane. Companies like CVS are systemically so neglectful and exploitative of their pharmacies that it's literally no wonder 14 more just in Ohio are pending the same exact outcome. Excuses and lies abound in defense of their practices, but the board compromise of pharmacists over in Ohio knows better. So it's literally insane to know what's going on over there. And we have to call it out. We have to call attention to it. If you're in the pharmacy industry, if you know a pharmacist, if you are a pharmacist, if you're a parent of a pharmacist, right, you know what's going on. But let's bounce back. I will stop on my old frustrations in big pharmacy world right now that affects who we are and what we do around here. Everybody in our local area knows what it's like to deal with a CVS or a Walgreens that is backed up days. This one, in a little bit of a lighter sense here, I wanted to point this out in our tech talk. Jefferson County Joint Vocational School Health Tech Program have a pretty cool new tool here. $63,000 grant, and they get what's called a HAL or HAL nursing patient simulator. Pretty cool. Able to get this 3D image of the human body. Those of you guys who have been to probably, post-secondary school, maybe you get to work in a lab where they have I don't know why I just stumbled on the word, but right, dissecting the dead bodies. And so, anyways, everybody who's donated their corpses to medical science, if you're maybe working on post-secondary stuff, you might have some access to them, at least in the state of New Mexico. But this is pretty cool because, high school, you're able to get access to problems right here where the lifelike, electronic mannequin can help students learn to recognize problems, including acute sepsis, AFib, COPD, exacerbation, opioid overdose, diabetic ketoacidosis, and a pulmonary embolism. So, simulator, wireless, fully responsive, gives people real-world experiences as they prepare for a career in the high school health field. The purpose, guys, of the simulator is to inspire patient outcomes for everyone. It's an excellent learning tool for students, and they will receive safe and effective learning opportunities in a safe environment. They will learn to give direct patient care, hopefully by practicing. They will learn to recognize and be proactive care for their patients. We'll stop in our Tech Talk segment. We're just quickly talking about that today, guys. I've been a little charged up today just because of that pharmacy news is frustrating to follow right now. So, we're going to do what we can to continue to try to change that. We will not let that narrative be controlled accordingly, and people in the pharmacy world want to get taken advantage of anymore. And it's been there, so I will be my brother's keeper for the future in whatever way I can. Anyways, guys, Herbal Wellness Corner brought to you by High Horse Cannabis Company. Shop High Horse Cannabis Company for all your cannabis needs 24/7, 365 here in Las Cruces. I want to call out here Philly headlines: heavy cannabis use increases risk of developing an anxiety disorder. Guys, you've seen headlines for this all around right now. Studies suggest medical news today. Brilliant ways for these people to, try to give a sort of weighted opinion. But let's put this whole thing apart, okay? Because this kind of thing makes people afraid of cannabis. Those who are cannabis confused or cannabis naive or cannabis curious, or even using cannabis, this kind of stuff can make you perhaps guilty about your use. Maybe there's cases where, you need to pull back on the dose or whatever it might be, but not because you read some headline that's going to trick you into picking yourself, right? Anyways, laughably, let's look at this. New study says cannabis may not be relaxing for everyone. 27% of people who went to an emergency department for cannabis use developed an anxiety disorder within 3 years, according to a study out of Canada. Research team from Canada said their research published in eClinical Medicine, largest study to examine the relationship between anxiety and cannabis use. Researchers looked at more than 12 million people living in Ontario, Canada between 2008 and 2019. None have ever received or been diagnosed for treatment of diagnosis for anxiety. The team examined World Health record data comparing the risk of developing anxiety disorder for those who went to emergency cannabis use compared to the general population. The results suggested that individuals requiring emergency department treatment for cannabis use were both at substantially increased risk of developing a new anxiety disorder and experiencing worsening symptoms for an already anxiety disorders. Jeez Louise. So they're looking at health record data for people who went to the emergency room for cannabis in Canada, right? Not to mention that, let's just say, mental health care in Canada has been a mess. According to the Canadian Social Survey on Quality of Life and Cost of Living, the Consumer Price Index in Canada rose 6.8% in just 2022, the biggest jump in 40 years. Costs of food in Canada up 8.9%, cost of shelter in Canada up 6.9%, cost of transportation up 10.6%, increasing the most in Canada. Such pressures have had a mental health impact on many people. None of this, which should be attributed to cannabis or correlated to cannabis. Half the population of Canada has been affected by inflation, the economy, and financial insecurity, according to a post-pandemic survey from Mental Health Research in Canada, and are showing signs of worsening mental health. In fact, since the previous year's poll, even the group reported higher self-rated anxiety, 33%, 32% depression, 31% suicide ideation, 23% alcohol, and 22% cannabis dependency. So you're looking at the Canadian quality of life survey, guys, and their consumer price index. Canada is a mess. But people are not happy in Canada. People are anxious. So looking at one correlation to another, if you went to an emergency room reported for cannabis use, that somehow you're going to develop anxiety later on in life, when later on in life, what happened? The pandemic. What happened? The Canadian government, went over the edge, right? So, again, taking these things completely out of context. Insane. What did we talk about the other day? An actual, good study out of the very few, said the number needed to prevent of cannabis users from receiving the diagnosis of psychosis. The heaviest group of cannabis users, males aged 20 to 24, you have to have 2,800 males in that group of heavy cannabis users completely discontinue using cannabis to prevent one incidence of psychosis. Causation and correlation, words that get very loosely thrown around. Bashing cannabis is, for whatever reason, a very attention-grabbing headline there. And, just insane, because promoting cannabis gets you throttled on pretty much most internet platforms. So if you're talking against it and saying these nice studies, you'll get put to the top. Weird, All right, guys. New Spotlight brought to you by the Big Chicken Farm. Showing you the White Sands Missile Range Arts and Crafts Center. I probably need to go do something like this right now because I'm pent up today. Ceramic, hand building, and wheel classes over the next 8 weeks on Tuesday and Thursday, 8 3-hour classes. Classes starting in February, 9 a.m. to noon, 12:30 to 3:30, and 5 to 8 p.m. $150 a person. Pretty cool stuff. Take a drive over the mountain pass. Go learn how to do some, cool arts and crafts, and take some stress off. All right, I don't have that up there on the screen for you. There it is. I like that one. All right, last thing, guys. Men's Health Minute. Just want to show you a couple things. And, today I'm on a rant, so we're staying on the rant. All right. Take a look at this Google. Google Men's Health. Google Men's Health News. Look at that. Men's Health Magazine. Every single article. Men's Journal. Another men's magazine. Men's Health, Men's Health, Men's Health, Men's Health, Men's Health, Men's Health, Men's Health. Sports Illustrated. Insane, right? Is there anything there that's actually about men's health? Google, I'm asking you, this is for your algorithm. When you Google women's health, Blue Cross Blue Shield in Massachusetts prioritize women's health with a new clinical team. Racism impacts black women's health more than genetics lifestyle. First Lady in Atlanta spotlight women's health. Testosterone be a useful treatment for menopause. First Lady promotes women's health research in Atlanta. Breastfeeding benefits mothers as much as babies. Public health messaging only tells half the story. Look behind CVS MA's expanded care for women's health. Growing maternal body mass index and perinatal health. Joe Biden, boosting women's health research, right? Back to Googling men's health. How this guy got ripped in 15 weeks. How Mark Wahlberg bees Mark Wahlberg. What are the horror movies? Henry Cavill is not a fan of filming sex scenes in the movies. None of the things when you Google men's health actually help with men's health. It's just a society factor of what you would be grabbing as you're waiting in line at the shopping store, right? Jeez. So anyways, in terms of something that's a problem in America, maybe this is partly why, right? What is Google's definition of men's health other than a magazine? That's an algorithm flaw. That is messing up healthcare, and I'm done with it today. Everybody has a great night. Stop ranting, but appreciate your pharmacist. Hope your system will get better one of these days. We'll get there. Please,